Magic 89.9.
The music of mayonnaise would live your life. On today's best music, it is 6/24. Check out the Rudy Project end of season sale from July 30 to August 4 and get up to 80% off on selected items. Follow at Rudy Project PH on IG for more details. Hi, Doc. Crazy traffic.
I know. Hello,
My goodness.
everyone.
But you're here. The resident health nerd is here already. And he brought me a late birthday present. Doc, you're so sweet. Thank you.
I was supposed to be during your birthday, but nonetheless,
thank you.
better late than never.
Thank you. And thank you for showing up on a Saturday for the cupcakes. You know,
it's gonna be-
nakiramay si Doc
cool.
sa amin. But
That's
thank
cool.
you. So, Doc, before I did the second set of songs, I was telling everyone how excited I am to talk to you about freaking K-pop Demon Hunter soundtrack.
Seriously, you have to watch it. I mean, just for the sake of it. I mean, it's just a movie. It's an hour and.
I haven't seen it.
That's why.
But Yaya put on something on YouTube, and then
gotta listen
my
to these
nieces.
songs.
My niece, she's like 3. She was singing along, and I'm like,
She memorized Golden
And
at
then-
this point in time.
I'm not sure what song it was. Soda Pop, I think.
Oh, Soda Pop as well.
And Yaya's like, ate yun yung K-pop Demon Hunter. And funny enough, I was talking to a buddy of mine, my old partner on 99.5 RT, one of my radio partners, Robbie Joseph. He goes, so funny. Because it's mostly guys who would tell me to listen to the soundtrack. Kim and Dawn. How
The
funny
irony
is
of
that? Hold on. This is what he said. Crap, where is it? Oh, I
It's
lost
just gonna be
it.
there.
It's gonna be somewhere, but he's just like, listen to the soundtrack. Okay. Anyway, so which song is your favorite?
Well, I love Soda Pop, but Golden, I mean, the voice of, and I understand the girl who sang it isn't even a singer. She's like a songwriter and a producer, but she happens to be singing her own song. So
Okay.
beautiful. I mean,
Obsessed.
Oh, and by the way,
So what do you listen
most of
to
us
when
are
you do your
kidding.
surgery?
Most of us are kidding. Not surgery, but CPR,
Yeah.
cardiopulmonary resuscitation. Nowadays, it's a hands-only cardiopulmonary resuscitation. You don't do you pump and then you breathe. You don't do that anymore.
Okay, the
It's
guest behind you is
continuous-
totally agreeing.
It's continuous chest compressions, practically 100 to 120 per minute.
Okay.
So they used to sing this old song like Staying Alive,
By the Bee Gees.
right? I mean,
So did you guys switch to K-pop Demon Hunter soundtrack?
Staying alive, while trying to pump chest compressions. But now, try to listen to Golden. And that's what you'll literally do.
I have it right now. I have room for one more song. Oh, you know what? We might as well. Here we go. Isabay natin sa pag-pump ng heartbeat.
And see that.
Here we go. I haven't seen any episodes. I'm obsessed with the soundtrack already. Golden on today's best music. This is Healthline on Magic 89.9.
Magic 89.9.
Olivia Dean, nice to each other on today's best music, Magic 89.9. Doc, your superstar patients tuned in. Superstar! I want to say congratulations to Jack.
Congratulations.
TCL Player of Game award at the recently held FIBA Women's Asia Cup held in China. And she's on her way to a fancy party, like Tatler levels though. May award siya. Malalaman niya kung ano. But hi to Vern as well. Thank you so much for keeping us in the background. Tonight is a very special episode of Healthline, like it is naman every
Always.
Wednesday. It's just this one hits closer to home because my beautiful niece is joining us, Daw.
Yes.
I mean, the field is very new in the U.S. and it's something I've never heard of as well.
Let's hear what exactly it is.
Exactly, we'll find out. Keana, you want to say hi?
Hi.
How beautiful my niece is. My sister's also here and my brother. It's like a family
It's
affair.
like a family reunion here.
It is. I mean, we're kind of like done with the whole being sad. It is what it is. Dad's gone, but hey, we're all here, and I'm happy that they're back for a few days. So, hi, baby girl. Look at her. her. She's so pretty. If you guys don't know what our streaming site is, it's playback.tv/magic899. We're going to talk to her in a bit, like very, very soon. And also coming up on the next hour, we're going to talk about women's health.
Women's health.
Dr. Michelle Dado.
Michelle Dado, and an obstetrician and gynecologist.
There you go. I never really knew what OB stood
We'll have
for.
her explain it as well.
Yeah. Let's go. All coming up on Healthline right now. More music. This one's from JR. Pakita mo sa akin. Ang alin.
Magic 89.9.
Today's best music, Magic 89.9. This is Healthline. I'm Tina Ryan. With me is my DNA profiler. Sounds so fancy.
Just a carpenter.
Orthopedic surgeon, Doc Rylan Flores.
Yeah, Dr. Rylan here with Tina Ryan.
Okay. Ito to, Doc.
We're really rolling now.
I'm so excited for our very first guest for this episode. Please welcome Ms. Keana Gonzales, a child life specialist, joining us all the way from Dallas.
I know.
Texas, where they say, go big or go home.
Exactly. We were just talking about boots in a while ago.
And you said you've been to the U.S. so many times but never been to
Never
Dallas.
been to Texas.
Okay. Never been to Texas.
Soon.
Okay. Hi, Keana. Okay, thank you so much for saying hi, yes to Auntie, first and foremost, okay? I'm just so proud of you. Let me be a proud aunt, okay? So, for our first question, I've never really heard about child life specialists. What is it really that you do?
Yeah, I would say a child life specialist is sort of like a teacher at the hospital. So we help kids understand the different things that we do at the hospital, such as the procedures that they have done. If they get diagnosed with something, we prepare them for those procedures and support them along the way. We also work with the siblings because a lot of the times too, they can be kind of forgotten in the process, and also to help them understand what they can do as a sibling to still help the patient, but also to understand too, to explain those things when they go back to school as well.
Wow. I mean, this is something that usually is a neglected part of any medical aspect, whether it's a procedure or just knowing what your diagnosis is, because what most of us doctors tend to literally concentrate on what the problem would be and concentrate on what the treatment options would be.
Yeah.
But looking into the psychological aspect of the patient, trying to understand, and we're talking about kids here.
Yeah.
Because I mean, it's difficult already for the adult, more so for a kid.
Yeah.
And not just that, but the beautiful thing I heard was the siblings are also taken care of. Because
it's part of their
at
job.
one point in time, yes, they become neglected as well, because everyone's concentration would be on the one who has a problem.
Yeah.
And if it so happens that there are like 1, 2, 3, 4, or 5 more siblings, they tend to be neglected already at this point in time.
Okay, I'm saying hello to everybody on playback.tv/magic899. To Christian, thank you so much for the kind words. Also to DJ Far90, hey wonderful people, says hi. And JP, hi. Also to you, Keana. Okay, flex ko lang do.
Go ahead.
Keana is a summa cum laude.
I know. Alam ko,
Guys, summa cum laude
may
lang naman
kadugtong
ito.
yan eh. Alam ko may kadugtong yan. So that means that the aunt is ...
From Texas Christian University. Summa cum laude. Ayan. Okay. For our second question, baby girl. Baby girl. Okay. Is it true that you use play as part of therapy? And how does playing help a child who's sick in the hospital?
Yeah. We look at play as meeting the child where they're at. That's kind of their first language. And so by working through their play, we can understand if they have any misconceptions with the hospital. So we'll do a lot of medical play. So we'll incorporate...
Wait, medical play?
I think I like that.
Oh my gosh.
Medical play.
Wait, okay.
That's a new thing for me now.
Medical play. Interesting. Okay.
So I would say one of our most popular forms of that is giving an IV to a stuffed animal.
Oh,
so
to make it
I
less
used to do that.
scary.
I used to do that when I was a kid.
Okay. Which stuffed animal did you
Well, I have this teddy bear that's actually older than me. Like regular teddy bear. But older because my dad bought it even before I was born. Like a couple of days before I was born.
Okay.
So it's literally older than me.
Wow. Okay, so what else? Like putting the IV, the needle, what else?
Yeah, so a lot of that comes with most children believe that the needle stays in their hand or their arm when we give IVs. So with that, they're able to see that the needle actually comes out and all it is just a plastic straw. So a lot of the times we'll refer to their IVs as their medicine straws. and so that they can end up getting their medicine through that way instead of drinking it by their mouth.
I would have probably thought of it different when I was a kid because up to date, I mean, I do a lot of procedures. I do stick needles in a lot of people, but try to stick it on me. I mean, we're going to do a marathon and run after each other until you catch me.
But Doc, correct me if I'm wrong. The field she's in right now, it's relatively
new.
I don't think we even have one here yet.
I'm not so sure, but let me try to look into it.
Please call your people.
But this is definitely a new field.
Yeah.
Because if you look at it, it's not so much as the science of the actual disease entity. We're looking on the complexity of a problem beyond the actual problem.
Yeah.
So this is one thing that most, as was mentioned, it's kind of neglected.
Yeah.
And looking and concentrating into it at this point in time is really, really a must thing. I mean, now that you've mentioned it, so even if I do talk to a patient or the parents of a patient, considering if the patient is a child or teenager, you don't just look at that anymore. I mean, my mind's being opened right now to looking into each and every person involved.
Member of the family.
Not just the parents, because usually you just talk to them for the consent.
Yeah.
But trying to look back now to a child that's literally trying to understand yet what he's all about, and now...
No, I mean, especially, sick children. I mean, Keana, how do you even explain something serious like cancer or chronic illness to a child without overwhelming them?
Yeah.
I mean, it's scary.
Not even cancer. Let's talk about other metabolic problems like type 1 diabetes. I mean, they usually are discovered in an early age, or juvenile rheumatoid arthritis. I mean, they're not that deadly, but you get sick all throughout your life.
So how do you tell a patient, a
we
kid
break
that?
down like those big complex words.
Sorry about that.
Spell juvenile.
No, it just makes us kind of look like more intelligent. That's why.
He's just trying to sound smart. He's a nerd. He's a nerd, baby. He's a nerd. Okay, so you break down the words first.
Yes.
Okay, it's big. They're big.
Of course.
Okay.
And then we also, of course, we believe that parents are the experts of their children. So we really want to build a relationship with them to understand what we can do to better support them and understand what they want their child to know.
So it's
we
like,
understand that they're the ones going home with them, not us.
so that's kind of like, I don't want to overstep my boundary as a...
Yes.
Oh, nice. Okay. What about... what's the best thing a parent can say or do when their child is scared at the hospital?
I would definitely say acknowledging their feelings of being scared and offering reassurance. A lot of the times we'll have parents that will tell their kids not to cry, but at the end of the day, crying is coping. It might not be the most widely accepted of coping, but it's still coping, and that's how they're getting out their emotions.
No wonder grandma, I'm a crybaby.
Yeah.
For one thing, what we wouldn't want to tell people out there is quit scaring kids with doctors. That's the reason why you have that white coat syndrome.
Oh, yeah. Filipinos are notorious.
I know. Like, ay nako, you're doing bad. The doctor will inject you. Heck, that's why I'm scared.
Yeah. We have that in the U.S. too a lot. So it's also just reminding those parents too that we are here to help their child feel better. The hospital is a safe place. We don't ever want them to see it as something that is scary.
That play thing is actually good. And that's the reason why, if you notice, if you go to hospitals right now, you won't see much of the white coats, especially in the pediatric wards. You'd actually see like scrub suits with cartoons and all these things. And you'd notice pediatricians would be having all these trinkets.
Do they have like a clown nose? I'm just kidding.
A whole lot of labubu.
Labubu talaga. Give me 1 second. Here we go. The next question. Hold on. I lost it. What are some of the red flags that a child might not be coping well emotionally, even if they seem okay? Do you see that?
Yeah. What we'll do is, again, like I said before, it's like we'll really lean onto the parents, because sometimes our interactions with meeting them is so soon and we don't have all that time to build a lot of rapport. So we'll assess the parents and see if the child's at their baseline. Are they acting like they usually do outside of the hospital? Or are they acting different? sometimes we'll see regression. So kids will maybe start using a baby voice that they don't use typically anymore, or they'll be having like bedwetting incidents, or just kind of like shut down emotionally and not really engage with us. And in those moments, we'll just kind of play, or we'll do more of maybe a silent activity to draw out maybe more of that personality through like drawing, coloring, things like
So
that.
it's
But
different.
this is
per
all what
patient.
you do for the child, right?
Yes.
In creating that rapport with the parents. My question is, what about parents that have seemingly no time for their kids because they're at work, they have a lot of work.
Do you have
they
a
need
lot
to
of
work
that?
for the
bills,
for the bills
right?
of the hospital. So what about how do you deal with these parents?
I would say we still kind of empower them because they are the ones that are with those children like outside of the hospital and the ones that are still taking care of them. But also too, that's also when we kind of also lean on the siblings, because this also gives the siblings a sort of
A little more
purpose and a role in the
responsibility.
hospital.
Yeah,
And so they're able to feel important.
if the child is younger, like I'm the one who's kind of responsible for taking care of it.
Yeah.
Or if he's younger, he could be like helping out and not and make sure that the elder sibling is having a comfortable life.
There you go. For those of you who just tuned in, this is Healthline here on Magic 89.9. We have Doc Rylan Flores, my co-host on Wednesday evenings, and my niece, who is a child life specialist from Dallas Children's Hospital, right?
Yes, Children's Medical Center Dallas.
There you go. And yeah, she's here for a few days, and again,
And it's great having her here at this exact time.
I know. I'm just like I'm a proud aunt. That's all it is. Baby, Keana. How do you think schools or teachers better support students going through medical or emotional stress? Because it must be tough going to school. You're already getting bullied, and I know kids can be mean sometimes. They're meaner when you're sick.
Really mean.
Right? I mean, how do you teach, I guess, teachers or, okay.
We do what we can to help normalize the environment in the hospital if they're there for an extended amount of time. So a lot of that is working with the teachers to understand if we can kind of help them create more of a schedule with their school and getting them still caught up with their assignments and their homeworks, because we don't want them to feel that much different. We understand that, yes, their body is undergoing a lot with the medications or with the treatments, but we still want them to have that routine and still feel that sense of normalization.
Oh, no, yeah.
Yeah, but let me
okay.
try to step back. We're talking about a kid that has a problem or a disease entity. But do you do also like some form of a wellness lectures or talks, like to classes, so that the other kids who are seemingly normal could understand when they do have a classmate who's actually sick?
Oh.
Yeah, so sometimes we'll go to the schools and present to their classes.
Wait, so you go to the schools too? I thought it was just like it's like within the hospital. Oh, that's amazing.
Yeah, so
okay.
depending on if we have that time and flexibility, we'll be able to go and meet with the teachers to present or like help give them kind of a better understanding of what they can present to the class about maybe the child's new diagnosis, or even if they have a cast on their arm, in different ways that even the students and the classmates can be helpful.
Okay, Doc, I have
It's a
to.
support group, literally. It's a
Right?
support
Oh,
group.
mini support group. Okay, it is 7:00. We have 1 more hour of Healthline. I gotta play one more song before I give you back my beautiful niece. Yes, babayaan niyo na ako, guys. I'm just flexing, okay? We have Child Life Specialist Keana Gonzales with us here on Healthline.
Magic 89.9.
Today's best music, Magic 89.9. Sleepy Hollow, Girls Like Girls. Before that was Soda Pop. From the K-pop Demon Hunters soundtrack, which I am obsessed with. I have to save the actual animation for another day. Woo! Okay, so this is Healthline with Doc Rylan, and I'm Tina Ryan. We have my beautiful niece, all the way from Dallas. She is a child life specialist. Hi, Chris. I thought Keanu reads in the booth. No.
Oh, thank you.
No, Chris, huh?
I was going to say, thank you, but you have to have your eyes checked now.
See, DJ Far 90 had a question, but I can't quite figure out what the last word meant. Maybe it was a typo. But Kiki, he is asking, how do parents? Hold on, where is my mouse? Hold on, it moved again. How do parents balance the child play on the situation to get more?
Probably more response or reaction from the patient.
Okay. What do you say?
Yeah. I would say as far as like when you're at the hospital, definitely just kind of checking in with the child and either like assessing for what they know and maybe seeing if there are any misconceptions that we haven't gotten to assess, because a lot of the times too, kids might be a little bit more honest or vocal once doctors and staff leave the room. So parents can do that due diligence of checking in with their kids to see if maybe there was something that wasn't completely fully understood by the child, and having the child life specialist kind of come back in, or the nurses to help address those misconceptions and help them understand better, because at the end of the day we just want to build that child's resilience.
No, and because
That's my niece, Doc.
I know.
Hi, Bella.
No, but the good thing is, I would agree, because most of the time, if the doctor comes in, and if that doctor is like a senior doctor with a barrage of other junior doctors, they tend to just speak and then hoping that everybody else in the room, especially the patient, would understand. But the moment the doctor steps out, then that's when the questions arise. I mean, even if the doctor asks,
And that's where you come in.
Are there any other questions? They'd say, no, I think we're good. But the moment they step out, but what's this? What's that? How do you do this? And how do you do that? So I think these are the things that I usually have lapses. And it's such a good thing that these are not being taken into consideration.
Yeah, and that's
love
where
that
they
idea.
come in. Have you ever had a funny or heartwarming moment with a kid that really stuck with you?
Yeah. I would say I work in the emergency department, so we see children on their worst days. And so I would say getting to see them smile for the first time that day after like a big accident or them not feeling well is definitely something that makes my day. I've had just some silly interactions with patients where I'll ask them just about like their classmates or their siblings. I've had like one little 4-year-old boy tell me he has children.
Is that the wildest thing?
That it's his classmates, and that it's because the teacher calls them her kids, and so he mimics that behavior in that language. So it's always just kind of funny when you talk to the kids one-on-one. If they're very chatty, like Tiff and Sage are, you never know what's gonna kind of come out of their mouth, and sometimes the parents are like,
Because, kids say the darndest things.
You'd be surprised, literally.
Now, what are some things parents can prepare before a child goes into surgery or a procedure?
I would say kind of like what the doctor was saying is reminding them that the hospital is a safe place and that everyone at the hospital is there to keep their body safe and to help their body feel better. And so providing that reassurance that they're going to be there with them at the beginning and at the end, and then having those real honest answers. A lot of the time some parents can feel afraid of making their child sad or upset or disappointing them, but when you don't necessarily tell them the full truth, it breaks that trust. And so we want to be honest with children and understand that, yes, they are going to feel those sad emotions, but what we can do is build that resiliency, and we're going to build trust so that they know that they can go to their parents when they're feeling scared.
Doc, have you ever had to tell a really young patient that the procedure is going to be really painful? How did you handle that?
What we would do too is a lot of our job is also advocating for our patients and our families. So talking to the doctors about if we can provide any other medications for pain as well, or we also provide a lot of procedural distraction, whether that be through having a tablet or an iPad or other toys to kind of help with distracting them as well. We also have a lot of non-pharmacological pain management strategies that we can use as well to also help with that.
Okay. Hi to Aperture. Hi. Thank you for messaging us on playback.tv/magic899. If you have any more questions for our child life specialist, Keana Gonzales, she's going to be here for another 5 minutes. Are there helpful apps, books, or toys that you recommend for anxious kids?
I would say a very helpful app that we use a lot is called Simply Saying. It actually explains a lot of the different either medical procedures or diagnoses that are pretty common, such as like appendicitis, or
that's
even
painful.
like type 1 diabetes, and so on their level, and so it can also even do other imaging such as like a CT scan, an MRI scan that even has the sounds of an MRI scanner, because if you ever had an MRI, it makes some crazy loud
Yeah, they had to put me to sleep.
Not just for kids. Not just for kids. Adults likewise go crazy with an MRI.
And that's why I haven't done mine in a long time. I'm claustrophobic, baby.
I can show you the app when we're done.
That's so cool. Show me that too.
Yes.
Now, how do you handle kids who just shut down and just don't want to talk?
Yeah. I would say just being comfortable with the silence. A lot of the times we are just meeting them where they're at, and sometimes that's showing up when there's silence and being present and just breaking down kind of like those barriers and to build rapport. We don't necessarily have to have this super amazing conversation to build rapport. I think a lot of those times it's just being there for them in those small moments as well. Whether that's bringing them something, either maybe they said they didn't want anything, but still kind of just checking in on them afterwards just to kind of show that we're there and we're a consistent support system for them.
You know, I think just literally, if the kid is silent, being silent with them, just making sure that you're just beside them is actually already creating that rapport.
Yeah.
And time will come when they will open up to you once that trust is built.
The legal drug expert 26 on playback says, good evening, interesting field. It is very interesting.
is.
And I'm so proud. Dr. Michelle Dado is with us already. Hi, Doc. I'm flexing my knees. Child life specialist. Summa cum laude.
Hi. Good evening. I'm sorry I'm late.
Oh, no, you're
Traffic
not.
is really
You're
short.
just in time. We're going to talk to Dr. Michelle Dado about the reproductive system later on, which I have a lot of issues with. But yeah, Doc Michelle, meet my niece Keana.
Hi, sweetheart.
Okay. Oh. Okay. So, last but not the least, how do you? What's your most favorite part about being a child life specialist, baby?
I think my favorite part is kind of like I've mentioned before, is just being there for children and family on their hardest days. A lot of the things that we do, as well as providing that procedural preparation and support, also comes with the very hard days, which include bereavement support. And so being able to be there with families and walk through them during that time and helping siblings understand that life is going to look different and what we can do to aid and better equip families for that time afterwards, I think is something that, although it is very hard, I do find rewarding in knowing that we're able to be there for them when it's a really tough time.
Wonderful. I have no words, Doc.
It's something we literally
Yeah.
have a need for. It's taking care of everyone else from the start of the diagnosis all the way to palliative care and after. So it's the entire thing.
Should we start? Should we start having her train?
I think so. Yes.
Oh my gosh, baby, you're gonna be here every year to train people. Thank you so much, Keana, for joining us. I'm sure a few listeners out there would like to message you, maybe on your socials.
Yeah.
Would you like to give that away if they have any
Yeah, of
questions?
course.
Go ahead.
It's at Keana Gonzales, KeanaGonzales at Instagram.
Thank you so much, Keana, for making time for Auntie.
Yes.
I have no. Doc,
And
I'm
good
sorry.
luck.
Yeah.
You don't look like your auntie.
No, she does not.
We're going to take a, well, no, you know what? I think I have room for one more song before I take a break. And then we're going to have Doc Michelle Dado up next here on Healthline. Here's Ed Sheeran's latest.
Magic 89.9.
The music of Lola Amor featuring Kokoro. Is that right? Bella, did I pronounce it right? Okay. Bella is the 24-year-old daughter, wonderful daughter of Doc Rylan, who just loves K-pop. And what else do you love? A lot of things. She's off to Paris in a few
I
months.
was actually going to say my younger sister.
I know. Actually, the way you guys interact, too funny. I love it. I love it. So it is 7:26. Welcome back to Healthline. I'm Tina Ryan. Doc Rylan's
Doc
with
Rylan
me.
here.
We're switching gears, although that interview with my niece, I'm sorry. I'm just
Yeah, that was
fangirling.
really good. Yeah.
Thank you, Doc Michelle. We're going to, we want to welcome our second guest tonight. She's an OB-GYN with a passion for empowering women. Dr. Michelle Dado, welcome to Healthline.
Hi. Thank you for having me.
So, Doc, how do I know? Okay, for our first question, Doc, what are the most common misconceptions women have about their reproductive health?
Okay, there are a lot actually. Some would say that it's normal to douche That's a misconception. It's not. It's not a recommended thing that you need to do.
Because it breaks some pH something, right?
Yeah, it actually, because there is a vaginal flora that we need to maintain inside our private part. And if you keep on douching, you destroy the pH level.
Yeah.
So you make it basic. So because of that, you're now more prone to infections.
Rather than not having any infection at all, which
Wait,
is the main
so
principle of that.
why do they push it then? Oh, let's not even go there. Yeah, let's not even go there. Yeah, okay. So douching is not recommended.
Yeah.
Okay, another misconception.
Okay, taking a bath. I'm not taking a bath during menstruation.
Hindi ko kaya. Whoever had the brilliant idea.
The older ones, I used to hear that. I'm no OB,
Do not
but
take a bath. Do not eat mga maaasim, mga sour foods during the time that you are menstruating.
What about maalat? Are you allowed? Kasi di ba
These are your
PMS?
cravings.
Yeah.
These are your cravings. You can, but everything in moderation, syempre, diba? It's very important that you can have a little of everything because you're craving it. And the more you don't get it, the more
you crave, and the more you crave, the more you eat. By the chance you get that.
konting chips lang, diba?
I would want to be. Can you define what konti?
I know, right? Don't. I stay away from chips
Her
during
definition
PMS.
of konti is literally
My gosh.
a whole lot
But
different.
ano ba yung mga misconception ng mga Pinoy about period, diba? Bawal maligo, bawal, ano pa ba
Na
yun?
madumi siyang blood. It's like dirty blood. It's not. It comes from your inside, so it's not dirty blood. So some would... and another one misconception is that in order for you not to have pimples, for young girls, the very first menstruation, you put it on your face. Oh my goodness.
Here we go.
Wait. This is the first time I've heard it. Hold on. Can you? What's the misconception?
I have heard of
No,
that.
I haven't. That's why. Can
That
you?
is so yucky.
Vampire facial
Can you backtrack?
I mean, menstrual blood is clean,
But
of course you don't put it on your face.
Okay.
All right, so it's not normal. These are the more common things that people think that it's true, but we have to really bust it out kasi hindi talaga
First time I heard that.
my
So do not put
gosh.
blood on your
that
face.
particular thing.
Oh my God. Okay, I don't
Take
think
a
I do
bath
that.
when you have menstruation. Diba?
Oh my goodness. Doc, when should, for those of you just tuned in, Dr. Michelle Dado, she's an OB-GYN.
We were just asking.
With us tonight.
We were
Doc,
talking
go.
off air that we usually hear OB-GYN, obstetrician, gynecologist. I know it's two different things. So what separates one from the other? And can you be
dapat
just
ba-
one or do you have to be
or-
both?
Yeah, pwede ba yun, Doc?
Actually, pwede naman.
Oh,
Separate
okay.
kasi ang OB, you take care of pregnant women.
Oh,
Take care of
okay.
pregnant women. While a gynecologist is the one who takes care of
The reproductive system.
everyone, all women who are not pregnant.
Ah,
Yun yung mga...
appear, Doc. First heard here on Healthline.
Yeah.
What happened, Vela? Vampires now. Thank you,
Oh my
designer
God.
dad. I mean, that's crazy though.
Yeah.
That's gotta be, I mean, I've heard that a few times as well. Welcome to Healthline. For those who just tuned in, it's 7:30. When should a young woman start seeing a gynecologist, Doc? The first cycle?
Yeah, it would be better to
Okay.
actually, the minute that you have your menses, it would be good to see a doctor or a gynecologist because there are a lot of questions that you will have. You may experience pain,
Oh, yeah.
or you may experience irregular cycles, but most of the time it's the moms who bring their kids to us. But they usually just bring their kids when they have irregular cycles already, or there are some symptoms that accompany the menstruation.
Like a bit late.
Yeah.
Okay.
But most of the time, if I'm not mistaken, it's the mothers that usually already discuss about expecting that first menstruation.
Yeah.
Right? It's called menarche. So I think it's more of what the mom might not be able to explain.
Yes,
Or
exactly.
if for one reason or another the mom isn't there, the dad literally couldn't
Or
explain.
the moms or the parents are old-fashioned and they're not really open to discussing these kinds of
Yes.
things.
Oh my
That's
gosh,
you.
who else am I
That's
gonna run to?
you.
My girlfriend who hasn't had her period. Parang ganun, diba? Ang
Diba?
hirap.
Usually kasi friends talk about it. Oh,
Yeah.
nagkaroon ka na ba? Meron ka na ba? Meron na ako last summer. Parang ganon eh. So, there. But it should be the responsibility of the parents to actually discuss this.
Oh, there you go. There you go. Okay. Playback.tv/magic899. It's our streaming platform. If you have any questions, please send them our way. Also, the Viber line, Doc.
Yes, the Viber
is-
line is, here we go again, 0945-971-4011.
Okay, ito, Doc. I don't think I've ever met any girlfriend, or I've never had a girlfriend who never complained about painful periods or
Specifically.
irregular cycles. What's your advice for women
Alright,
dealing with that?
So if you have painful periods, first, what you can do is just find ways to be able to get through it. So drink more water. So water actually helps.
Water is life.
Hydration is key. Exercising at least 3 times a week will actually help
Yeah.
increase your endorphins. And if your endorphins are increased, you can actually feel better and you have less pain perception.
Because some say that the more you move, the more pain you'd have. That's why they don't
That's
move
not
at all.
true.
That's
That's
not true.
That's not true.
Eh, ito, skip 3 staircases daw para 3 days lang yung duration of period.
Misconception yan.
Thank you, Cass. Oh my gosh, that's a first. Oh my goodness. Okay. It was, I mean, like growing up, Doc, my teenage years, I mean, I was very irregular and it was really painful. For some reason, I got over it as I got older. But, ayun, triple ano siya. How important is emotional and mental health in OB-GYN care? Pwede ba yun? May ano ba?
Actually,
May correlation ba, Doc?
Yes, maybe
Okay.
correlation. Kasi when you have irregular periods, kids nowadays tend to think that they're not normal or it's causing them distress, especially if they feel pain. And because of this, they experience anxiety. And if their periods are very strong, they tend to withdraw. And they don't want to be with friends. They just want to stay at home because of the pain. They just want to, lie down. So, it's a whole problem. So there's anxiety, there's depression, there's fear that they might mess themselves. So definitely, we really counsel our patients about all these things, experiencing pain, how you handle it. Now, cycles can be irregular, especially if you're younger than 18, because your HPO axis is not yet, that's the hypothalamus pituitary ovarian axis.
I'm sorry, what?
Slow it down. Slow it down.
You lost me at H. What did you say?
HPO axis.
HPO.
Yes.
What's it stand? What does
That's
it stand?
from the brain until the ovaries.
Oh, okay. So my brain talks to my ovaries.
Yes. All right.
It does. It does.
It's still immature, so it's not yet, so your cycle can be irregular until up until you're 18. From the time you're 18, it should be regular already. However, for kids who have irregular cycles with family history of diabetes,
Oh, may
that's another problem.
correlation then. Oh
Yes.
my goodness.
It could be a first sign of polycystic ovarian syndrome.
Oh crap. Okay.
That's a
Oh,
whole
okay.
new other disease entity. But if there's one thing I learned from my OB class in med school,
And
is
as a
that
dad,
if there's anything regular about a woman's cycle, is its irregularity.
Guys, sa designer dad, kaya pala minsan nakakausap ni Mrs. Period niya, uy, next week na kasi may swimming sa weekend. Designer dad, I love you. You're my new fave playback listener.
another misconception pala is that they think that they're irregular if they don't have their period on the same date every month.
Oh, kasi
yes,
20.
You should not. It's not.
It's not like a calendar
It doesn't
thing.
follow that you get it every 18th of the month.
Pero
Hindi
like the
swel-
cycle
hindi
is
sweldo
20,
yan,
I know, every 20,
The normal is 24 to 38 days.
Okay.
So there's still that
28,
range,
yeah.
right?
Yes.
That's the reason why you may not expect it at the
Yeah.
exact date, but around that
So
time
if
frame.
it's 24 to 38 days, you may have it as early as 3 weeks.
yeah.
As long as 5
5 weeks.
Okay, so that is a misconception. So I'm like, oh, irregular ako because I got it
also,
early.
there's
Yes.
also one thing about that time frame for some that, well, like for couples, that because menstruation
for
didn't
the
happen
planning, okay.
for after 3 weeks, like, oh no, I'm pregnant already, or yay, I'm pregnant already. So sometimes that's where the
Yes. That's where
thinking
the
lies.
problem is. If you want to get pregnant, you have to know your cycle. If you don't want to get pregnant, you also have to know your cycle. When not to do it and when to do it. So it's very important that you take note of that.
The doc, is this a misconception that women are more emotional during the cycle?
No, it's not. It's not. It's a hormonal thing.
Ah! Thank you.
We have the
Thank you. We have an
license.
excuse. Please be kind to us.
Never cross a woman who is menstruating.
Oh, there you go. From
yeah, I learned
ayan, sabi ni
about that
Kaso,
the hard
yan,
way.
yan. Okay, yeah. So,
Yeah, we
connected,
learned the hard
Doc.
way. We learned the hard way.
Wait, how many kids do you have, Doc?
That's it.
Okay. Imagine, diba, if you and your mom had your period at the same time. Oh my gosh. Okay, yan. So again, Doc, please say that again. Never cross.
Never cross a woman who is menstruating.
It's hormonal. So we
Yes.
tend to be a little emotional, maybe clingy
A
and
little
needy.
angry.
Yeah.
It goes both ways. Either too emotional, too
Yes.
angry, too
You know,
whatever.
sometimes I tell my guy friends, like when they start little fights with the girlfriends,
Yes.
and they would joke, kasi nasa period niya. You know what, guys? Kami na yung nila, dinudugo na kami monthly, no? Be nice to us naman.
Exactly.
You have no idea, Doc, what we go through, how uncomfortable pads are.
Exactly.
Right?
Exactly.
And like the muscle stimulation when we're ano ba yung nagdidysmenorrhea?
This
That's
minute.
why it's good that we discuss these things.
Yeah. Okay, at least now, Doc, may kakampi na ako.
It's good.
Hormonal
No,
talaga.
okay. But the thing is, because anytime that one talks about menstruation or anything about that aspect, usually sometimes it's considered taboo in some
Yes,
places. That's
yes.
why it's difficult for a girl to actually find out all of these things
Yes.
if she doesn't, talk to somebody who actually knows
That
how.
is why it's advisable that young girls seek consult already with gynecologists, because if they cannot talk to their moms
About it.
about
yeah.
it,
Their moms,
you can actually
their
talk to your doctor about it.
That's right. That's
Doc,
right.
let's talk about. I mean, it's parang lately it's been a big thing, or big maybe binigyan lang ng pangalan yung PCOS. But what is how can you explain the link between PCOS and lifestyle / diet?
Okay, polycystic ovarian syndrome is basically a hormonal problem in women. Okay, wherein you don't produce the right amount of hormone at the right time, and because of that, you're not menstruating regularly.
Okay.
All right. It's linked with lifestyle basically because there is a study that says that any sugar intolerance may actually make you more prone to developing polycystic ovarian syndrome.
I'm sorry, sugar, you said?
Sugar intolerance, so that's diabetes.
So that's why if you have a family history
Yes,
of diabetes,
yeah, that's why.
the likelihood that you might have it as well.
Oh.
That's why when we do the workups now, we also check their blood sugars
Yeah.
together with everything else.
Correct me if I'm wrong, because there are several aspects to
Lahi sa buto
considering.
nito.
Well, yeah, but oo nga, kaya nga. But there are several aspects of polycystic ovaries that you don't necessarily have to have a polycystic ovary on an ultrasound for you to be declared as somebody who has a polycystic ovary syndrome.
Actually, meron siyang criteria.
Oh, see, okay.
There is a criteria that we follow. So there are some women who manifest with hyperandrogenism, manifested with acne.
Oh.
Okay.
Oh, I don't want that.
And
Okay.
acne, because of hormonal problems, is seen under the cheekbone, in the jawline, and around the mouth.
What?
So here,
So
right smack, like
here.
So
like
it's
where
not
the-
even on the
what-
T-zone.
like,
No,
like
not
where the
the
mask
T-zone.
is.
T-zone, go to your dermatologist.
Yeah.
Okay.
Oh,
Okay.
wait. So
Jawline?
T-zone, you go to the dermatologist,
Yes.
but the jawline and all.
Yeah, because this
Could
is.
be
Oh.
partly because of the hormones, so you can come to us.
Oh, so okay, because there was a time, Doc, I was suffering from like acne, pero dito lang siya sa leeg, and even I had it in the back of my ear.
So pwedeng hormonal yan.
Yeah.
Could have been hormonal.
Oh my goodness, I can use that as an excuse. Diba? Ay, hormonal. Back to designer dad. Kaso masungit si Mrs. Everyday, so di ko alam kung meron o wala. Sagot namin ni Cass, therapy. Ang sagot. For those of you just tuned in, it is 7:42 here on Healthline. I'm Tina Ryan. Doc Rylan's with me, and Dr. Michelle Dado, OB-GYN with us. I got to take a quick break, and then more of, we talk about the female reproductive system. I'm sure a lot of guys out there are curious as well. Don't be shy. Send the questions our way. I'm sure Doc Michelle's more than willing to answer those for you. So coming right back.
Magic 89.9.
The song is called Mad by Renee Rapp. On today's Best Music, Magic 89.9. This is Healthline. Doc Rylan joins me every Wednesday night.
Hi there.
And with us this evening is Dr. Michelle Dado. I wish we could have just kept the conversation going on on air, but let's talk endometriosis this time. You did mention, Doc, off air we were talking about how I suffered from 2 ectopic pregnancies, and apparently it had something to do
Could
with.
be the cause of your ectopic pregnancy or endometriosis.
I wish my sister stayed because she was the one talking to the doctor. So yeah, but I just remember one vivid thing. The doctor said that I had so many scar tissues inside, and I didn't know if it was. I didn't feel normal. But
Yeah.
But by definition, endometriosis, as it is, it's actually endometrial tissues, right?
Yes.
Which is supposed to be found
Inside the uterus.
The uterus.
But they're outside.
But they're outside. So it
But
still is
lumabas,
covered with it's still covered with the hormonal changes that's
Yes.
supposed to happen inside.
Exactly. What happens is when you menstruate, 80% of your blood go down as menstruation. But there's that 15 to 20% which goes up out of the fallopian tube. So that's what we call retrograde menstruation. And it can and it
Okay.
implants everywhere. So these are normal glands now in abnormal locations. So these are what we call endometriotic implants. And every month, you're correct, Doc Rylan, every month it still gets affected by the hormones, and so it bleeds every month. And the blood is not supposed to be inside the abdominal cavity.
It's supposed to go out.
It's supposed to go out, and it's supposed to be in our veins and arteries. Now, blood inside the abdominal cavity now causes actually tissues to stick together. So these are the scar tissues that Tina was talking about.
So the function of supposedly fluid movement of things kind of get hindered at this point in time.
Yes.
hindered talaga yun. No?
They just
I like that.
stick
Oo.
together. Flock together.
Aw, nag-flock together. My tubes along with. Doc Michelle, how would they go? I mean, like, how will they get in touch with you if they want to, like, consult or, like, say, ask a specific question? Where can we find you?
All right, I have a TikTok account.
Ah, how nice.
She's in TikTok.
Are you, like, dancing too on TikTok?
Sometimes.
No,
Okay.
But a lot of
yung mga-
questions are answered in
on
her
TikTok.
TikTok
Nice.
account.
And I'm sure it's, like, talagang layman's term, no?
Yes,
Like, talagang,
yes.
ito yan.
Yeah, my
Nothing's-
hashtag is Ask Me a Question.
Nice. Speaking of asking a question, what was the weirdest question you were ever asked about, the
Is it okay to put it on the things?
Seriously, that's really the first time I've heard it.
Mama Dada's tuned in. Sabi niya, pinagawa din daw sa kanya ng nanay niya.
Oh, come on, really?
No, really?
So, ito tanong, ginawa niya?
I'm waiting for her. I want to say hi first to Kuya Alex. Over there over the weekend I rented one of those what do you call this Hyla room and air cleaning system. It's not just a vacuum, it's an air cleaner at the same time, because I've been wanting to. I mean, it's super pang mayaman levels of vacuum, guys. But I finally found a company that rents it out, to take care of the dust and the mold, because I'm going to do some spring cleaning. So Kuya Alex, thank you so much for the wonderful demo, and you can find them on Facebook, Mother Nature's. Yeah, so I rented it for a whole month. So I'm not hormonal pag nakita nyo ako. I'm just in a cleaning mode.
All right.
Okay, Doc, what else do you want to tell the women out there? What would be your message to us women regarding our, reproductive system?
Very simple. You just need to take care of yourself. Pap smear it's not recommended to do it every year already now. Unless you have history of cancer. It's every 2 to 3 years. But it would be actually really nice and good for you to see your OB-GYN at least once a year to get checked.
Yun. Once a year.
What about usually, getting big, obesity, overweight is a big thing right now.
Yeah.
Is there any relationship with hormones and adding weight to the body?
Oh, that's a good question. Oh.
Definitely. Because if you have hormonal imbalances, it's not just your reproductive hormones. It's also your thyroid hormones.
Oh.
Together with everything else that regulates your sugar. So if you have thyroid problems, you can actually gain weight and have problems with your cycle.
And that's actually the reason why, for most, long ago, when we see overweight and obese individuals or those living with obesity, is that
blame it on the hormones.
Exercise lang yan and diet.
Yeah, you can blame it on the hormones now.
But now
yes, definitely.
there's a whole lot more to just that, more than just diet and exercise.
It's hormones and lifestyle.
Doc, can you get pregnant during period? Asking for a friend. What? Asking for a friend, Kajana.
If you are in the latter part of your period already and you and your what do you call this, ovulation time is very close to your period, you can actually.
And then you mentioned earlier about the douche, Doc. What's your take on feminine washes and products? Yay or nay?
Yay, but in moderation also. So you use it twice sparingly, because these feminine washes are very, very effective. So you just put a small drop, because Filipinas like to put a lot.
That was what my question would be. How much do you actually
a lot, enough to lather the whole body. You do not do that. So it's a pinpoint.
Ginawang sabon.
Oh, diba? So it's just a small dot because it lathers really fast. Tapos twice a day, and then in the middle of the day, just wipe with wet wipes that are specifically for just that.
Doc, early signs that a woman might be having fertility issues. What's the early warning signs?
Well, if you're trying to get pregnant and it's been like 6 months and you're really actively trying to get pregnant and you're still not getting pregnant, it may be actually a sign that there might be some fertility issues.
It's 6 months, because usually they think it would be a year or 2 or even 3. So it's actually 6 months.
It's really a year. But the thing is, pag 6 months na you're really actively trying already, it would be actually a sign already that you need to see a doctor and get help.
And sometimes it's not just. It could be the guys shooting blanks,
diba? With fertility issues, it's not just the woman. We also look at the partner. Yes. I mean, there are a whole lot of tests that can be done to ensure that, that it's not just a you problem, it might be a both of you problem.
Yes.
Is that something that you also deal with in your clinic?
Definitely. So when patients come to us, we usually do the workups for the couple.
Okay.
And then when we need to refer to our partners, the urologist, that's when we refer. If we find something in their sperm analysis.
So that's a partner, the urologist. We'll have one next week.
I know. Have you had as the physician, have you had violent reactions from the hubbies?
Well, okay, so not everyone
is medyo ego buster.
Not everyone is open to having sperm analysis done.
Why do you think so?
Because
It's a macho thing.
it's a macho thing.
It's a
gosh.
macho thing.
We always explain. I always explain. That's why majority, 7 to 8 out of 10 husbands undergo the sperm analysis, because I always tell them that one result does not mean you're abnormal. It could just mean that you're stressed. Now it takes
Stress.
It takes 3 abnormal results taken consecutively 6 weeks apart.
I was gonna say how long? 6 weeks apart.
3 consecutive
6 weeks. That's a
abnormal
month and a
tests.
half.
Yeah.
Oh.
So, Doc, have you had like a male patient lang na parang na-curious lang to just find out if, he's shooting blanks?
good or not?
Like without the wife, wala ka pang naging...
Wala pa ako naging ganun.
Okay. That is interesting.
Yes,
Again, it's 8631089. Walang binigay yung number, diba? Ang dami kong tanong kay Doc.
I know.
When should no wait. There is something about, is it true that taking the pill for years can affect fertility?
No, because when you're taking the pill, the effect of the pill is just there when you're taking it. The minute you stop it, everything goes back to normal.
The minute you stop it,
Yes.
because it's not something like you still have effects of it in a week or so.
No, kasi you get rid of it. When you drink it, at the end of the day,
You
you
just
flush it out of the body.
That's why it's a whole 3 weeks of pills on a daily basis. And
Yes.
if I'm not mistaken, there's specific pills for specific days. You can't interchange them.
Yes, exactly. So you do not self-medicate with your pills.
With pills, yes.
You need to consult your doctor.
Ito, question of the evening. Ito si Designer Dad, ang ating listener of the night.
Award!
May award si
natin yan.
Designer Dad. I love it. Doc, is it true? When they reach menopause stage, nababawasan drive nila to wink-wink. You know what I'm saying?
All right. Partly yes.
Partly.
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 Oh.
Partly yes, because of the hormones. But there are other factors that can actually help a woman have
The
libido.
drive,
The
okay.
drive, yes.
Okay.
What could this be?
Supportive partners
You know!
help them in their journey into menopause.
Oh my gosh.
Oh, I love that term.
If we-
Journey
women-
to
If a woman
menopause.
feels love,
Oh my gosh. Do you have a program for that for single women?
we can start something.
Right? Okay, you and me, Doc, we need to talk. Totoo po ba pag na-skip yung pills, lalong mabubuntis?
Yes, kasi
Oh,
you
crap.
need to,
Okay.
if you're taking what do you call this, the pills for contraception, you need to take it at the same time every day.
At
Because
the same time.
yes, the window period for me, the window period is just 1 hour. After that, it's already a missed pill.
Wait, so what happens
So it's
when
like
you miss
if
it?
Wait, for
Wala na.
instance, you take it every 7 o'clock, for instance, for what it's worth, every 7 o'clock. But you miss it because you had a meeting or something and you take it like 8:30 or 9 o'clock. That's already a missed pill.
na yun.
So what do you do, Doc? You skip the rest of the pills na for the month?
No.
Oh, okay.
Still
You
continue.
you take what you forgot, and then at least practice safe sex for the next 1 week.
Okay.
But you need to continue still.
Yes.
The question now
definitely.
is,
because everything will really go crazy. Your menstruation will go crazy.
when you
if stop.
continue, do you continue at the
Lalo kang
time you
hormonal.
start or at the same time? Like if it's 7 o'clock, do you continue at
Still
7?
7 o'clock.
Not because you skipped it and you took it at 8:30. You'll start at 8:30 after what? Not naman.
No,
naman.
You go
Oh,
back
okay.
to. That's why I always advise my patients, when you're taking the pill, take it with the most
Convenient time.
consistent
Consistent time.
activity of the day, which is probably brushing your teeth in the morning, because nobody goes out of the house without brushing their teeth.
Oh my goodness, Doc
I know.
Alex. Are you still tuned in? Hi, Doc Alex Santa Maria. Thank you so much for
Mona R,
all the
hi.
love. Hi, Doc. My goodness, it's already 8 o'clock.
I know.
Time just flew by so fast. Doc, that means we're just gonna have to be back because I'm sure Designer Dad has got more questions.
More questions.
I'm looking forward.
So how can we get a hold of you? What's your TikTok account?
Doc Mitch Dado.
Doc Mitch,
Doc Mitch
that's
Dado.
MICH or MITCH? Again, that's DOC.
DADO.
Okay. Now, on TikTok, it's
Doc, D-O-C, M-I-T-C-H, D-A-D-O.
There you go.
That's
Doc Mitch.
By the way, we failed to mention this lady is so busy nowadays because she's the current president of the Kansas City Medical Society. So she just came out of prison, literally.
Well,
a
thank
while
you,
ago.
Doc, for gracing us with your presence. Wow, thank you so much, and I hope we see you again because again, ang dami talagang madami pang follow-up questions si designer.
Teka,
part two.
baka isipin nila na I came out of prison talaga.
No. Wait. Pa-explain natin kung bakit came out of prison.
Ano prison yun?
No, we did the gift giving at Cap Karingal. So, together with Spark Philippines.
And I understand it was with other members of the executive board as well as the
Auxiliary. Yes, as well as the auxiliary.
Doc, ito daw pinagawa, yung panty daw niya pinahid sa face niya, pero may sabon naman.
Parang ma-stress ako bigla. I could just imagine.
Nagka-pimple ba siya or hindi?
Oh my gosh. Okay. And then I just have to briefly mention something about Kite Foundation. I'm sure you both heard of Kite Foundation. It's a nonprofit, non-stock organization aimed towards improving the quality of life among hospitalized children with cancer and other chronic illnesses. So maybe we should get in touch with Kite,
Yes.
right? Because I know they offer smile. They offer like parang mentorship. No, not mentorship. Parang ano. What is the word I'm looking for? Oh my gosh, I had 2 hours of sleep, you guys. Bye. Doc again, Doc Mitch Dado, D-O-C-M-I-T-C-H D-A-D-O on TikTok.
Yes.
If you have any more questions for her, Doc Rylan, where can we find you again?
Facebook, Doc Rylan.
And you guys can find me here hopefully next Friday if I have the balls too.
Yeah, but every Wednesday here with Healthline.
Yes,
Here
yes,
at Magic 89.9.
Thank you so much, everyone, for tuning in. Doc Michelle,
Thank you very
we hope
much.
to see you
I
back.
had fun.
Oh, mauulit yan, Doc. Promise. Kukulitin ka namin ulit. Hang on tight. Non-stop music for an hour, and then the boys are coming up at 9 o'clock. Bye, everyone. Oh, I forgot pala. Can I just invite everyone? Diba? I'm going to be singing live tonight at New World Hotel at La Noire. It's a new lounge. I'll tell you off air why we went there. But yeah, if you have nothing better to do and you're in the Makati area, I'll be at the New World Hotel at 9 o'clock. Bye, guys.
Magic 89.9.